Today we will discuss the AC assessment depth or your anterior chamber assessment depth. The anterior chamber assessment depth requires the pen light, and this assesses the patients with suspected acute angle closure glaucoma. Warning: if a patient is suspected of having a narrow angle glaucoma, he or she should not be dilated and should be referred to an ophthalmologist for evaluation. Before everything else, we will try to identify the anatomy of your anterior chamber. The anterior chamber is located between the cornea and the iris. Usually, the anterior chamber is deep and the iris has a flat contour. When the anterior chamber is shallow, the iris becomes convex as it is bowed forward over the lens. Under these conditions, the nasal iris is seen in shadow when a light is directed from the temporal side. As the shallowness of the anterior chamber increases, so do the convexity of the iris and the shaded area of the nasal iris. A shallow anterior chamber may indicate a narrow angle glaucoma, also called angle closure glaucoma, or a narrow angle that could close with pupillary dilation, thus inducing an attack of angle closure glaucoma. To assess for the anterior chamber depth, follow these steps. First, shine a light from the temporal side of the head across the front of the eye, parallel to the iris. Second, look at the nasal aspect of the iris. If 2/3 or more of the nasal iris is in shadow, the chamber is probably shallow and the angle is narrowed. If you are unsure of the extent of the shadow, direct the light more from the front of the eye, which will eliminate shadows, and then return the light to the temporal side of the head, and then repeat the test for the other eye. As you can see in the figure, the cornea is represented by the black arrow, while the iris is represented by the red arrow. Normally, the anterior chamber is deep and the iris is flat. As the light is illuminated in the temporal side of the iris parallel to the iris plate, the light will shine on all sides of the iris. If in case you see there is a shadowing on the nasal side of the iris, this will indicate that the iris is bent forward and the anterior chamber is pushed forward, represented by the orange arrow below, thus indicating an acute angle closure glaucoma. That would be all. Thank you for watching. Happy learning. Please do like and subscribe. Bye.